afternoon, everyone. Again, my name is Chris Ellsworth, Director of Sales for TPAs at Cotiviti. Today, we're going to be talking about the importance of keeping medical costs in check, particularly for self-funded plans and TPAs. One of the ways to do that is to deploy a full, comprehensive payment integrity program, one that's able to save clients money as well as help the TPA stay competitive in today's expanding self-funded marketplace. And we're going to be talking about some of the details of that program, as well as some of the factors to consider when looking for a partner who specializes in payment integrity. We know we have a number of different stakeholders on the line today from different types of organizations. So across funding types and across setups, there's one consistent goal, and that's a fiduciary responsibility to accurately administer these plans and help save and protect your clients' funds. So whether it's a traditional third-party administrator, an employer-sponsored self-insured plan, an administrative services organization, or any of the other funding types, the goal really remains the same, and that's accurate and lower-cost medical claims processing that helps save clients money and attract membership. And as a responsible entity for the administration, it's more important than ever to identify and treat misbilled and miscoded claims that lead to inaccurate payments. Cotiviti's been a market leader in payment accuracy for over 20 years, with over 100 client organizations that are present in all of these different types of funding situations and setups. And we're here to talk today about some of that experience and share our learnings in the space. Now, we see massive growth in the self-insured commercial population in general. In fact, more than 65% of covered workers in the US are in some type of self-funded plan. And we see this growth in both large and small groups, meaning more and more often across all types of employers, these groups are turning to self-funded options, often because of the control that they can have over these benefits. And we see that self-funded enrollments are actually outpacing fully insured models, including more and more in larger groups. So as the market shifts, so do the needs of TPAs and self-insured groups to provide payment accuracy services on behalf of their membership. And in tandem with the rise in self-funding, we're also seeing a continued rise in healthcare costs. So typically, healthcare costs are the second largest line item in employer expenses, ranking right after payroll. With an expected 8 to 9% increase in the average cost of an employer-sponsored healthcare coverage, that means more and more dollars are being paid out across medical spend by the employer, and therefore by their members. Often in these types of setups, there's very thin margins, and groups and self-funded populations are really looking for the best ways to save money, which is where accurate claims administration and payment integrity can come into play to help lower those costs. Many self-funded groups, believe that there is better cost control with a self-funded model, but we're actually seeing that premiums are increasing more for self-funded groups than fully insured coverage. So to help combat that and protect the member benefit, payment accuracy reviews can provide a huge lift in this space. Keeping these costs down goes a long way to helping your members keep that money in their pockets. So what's on your clients' minds when it comes to payment integrity? What are we really talking about when we mention payment integrity or payment accuracy? What we're really talking about is wasteful and inappropriate spending. Over $935 billion a year is considered wasteful or inappropriate across healthcare, accounting for just about a quarter of all US healthcare spending being considered erroneous or wasteful. And this is not just fraud, waste, and abuse issues. There are extremely complex regulatory guidelines, CMS and state guidance on clean claim coding and inaccurate code combinations, coding and clinical validations, as well as DRG and medical chart reviews that all need attention from any administrator who's responsible for the claims processing and the benefits administration of those groups. So as the market shifts towards self-funding, as the size of the self-insured pie continues to grow, that burden on accurate administration of these claims begins to fall directly on the shoulders of TPAs and the self-funded administrators. And then it also becomes a question of competition. Chances are the other self-funding options in your area are already offering medical cost savings through some level of payment integrity to their plan partners. Most health plans with self-funding options like ASOs or MSOs are already performing payment integrity, including coding and clinical validations for claims today. More than 74% of Cotivity's clients with ASOs are deploying prepayment payment integrity through our platform today. So it's a space that Cotivity has been in for more than 20 years, and we continue to see the push from the BUCA world to implement and deploy these services across their entire book of business, not just their fully insured claims, to keep their processing capabilities equitable and deploy their savings for both their funds as well as to be a good steward and an accurate fiduciary for their administrative services as well. So how does payment accuracy work exactly? So for that question, I'm going to kick it to my colleague, Mike Jablon, for some more details.
Great. Thank you, Chris. Yeah, so for those of you new to payment integrity with health plans or as a TPA, I'm going to provide an overview of what we view it as a vital function within claims adjudication. Common challenges that we see plans face when trying to put in place or administer cost containment strategies include, as Chris mentioned, having clean claim coding and available clinical expertise for payment integrity support, a provider and network support model to support education and inform your network about payment integrity policies that you're putting in place. It's being able to stay current with ongoing continuous regulatory changes or customizations that you may need, and also having the right support and adequate planning within your firm internally with your information technology colleagues, right? A good communication plan when you want to put in place different modules. So you may ask, why does your plan need a payment integrity program? You want to pay claims as accurately as possible the first time. So some TPAs are relying on leased adjudication systems, a payment integrity platform that maybe they have little or no input into, or they're conducting basic payment integrity functions in-house. This is not enough, in our opinion, with costs of healthcare being so high, and ever increasing, and the responsibility of TPAs to protect the member benefit. So what it is, a payment integrity service, at Cotivity represents as a managed SaaS service, right? Software as a service that we're managing on clients' behalf, receiving all claims post adjudication, but before payment to validate and conduct a comprehensive check that all coding is correct and that the claims are following recognized payment policies. It's an added layer of protection as well. So augmenting any internal activities the plan may be performing and provides clinically sourced and defensible reference-backed payment policies. Plans, you should have a comprehensive view, a holistic view, applying policy based on coding standards, not simply logic for things like high dollar claim review or little policies here and there. It should be comprehensive. And you should also have an interface for clear explanation of policy applied to both your internal staff for utilization, as well as an availability for your providers for self-service. What payment integrity is not, it's not cherry-picked policy, right? It's comprehensive payment policy applying all relevant policies available and appropriate for your plan's line of business and your network. It's also not installed software on your app. It's not left for you to manage yourself and budget for hidden costs of equipment or additional technology support. It's a managed service, wholly sourced and administered by Cotivity and our client teams to work in partnership with you to review appropriate policy, keep up to date with policy that's most appropriate to your plan and your providers. It's specifically not a set it and forget it type of service, right? It needs to be constantly monitored for changes in both the reference source material and changes that occur there, such as like government or association regulatory changes to keep current, right? A good partner does this for you on your behalf. In Cotivity, payment accuracy, it goes beyond claims editing. Claim systems themselves, claims platforms, they're constructed to process and pay for submitted claims. There are a number of checks and balances that exist to identify incorrect billing in these platforms, but it's not enough. TPAs need claims editors to look at claims holistically, again, and be up to date with the latest policies and changes. Our policy that we provide is dynamic in the sense that TPAs will benefit from Cotivity analysis and will regularly provide new policy to apply based on trending areas of increased cost associated with poor billing habits that contribute to waste. So you may ask yourself, well, why do you need payment accuracy? As we mentioned, claims processing systems, they do a good job of adjudicating claims, identifying errors, in particular pricing the claims for payment. But you may ask, well, why is there a need for the payment integrity level, the payment integrity vendor level as well? I think Cotiviti can accurately be referred to as a claims accuracy solution, as opposed to a claim editing tool. As mentioned in the slides that Chris was showing, your claim system catches the vast majority of coding errors, 95, 97% of errors, just based on adjudication principles. But we are not simply looking for the same edits that your claim system already has in place. We have different sources in many cases to ensure that the medical cost dollars being spent are being done according to the rules set forth by the industry. So that said, Cotiviti serves as a safety net in some cases when industry changes are happening in a time-sensitive manner. Other editing within the claims processing system are primarily updated on-premise as software or updated according to varied release and patch schedules. Once the release or patch is provided to the plan by other vendors, it must be scheduled by your IT department to be implemented, regression tested because of the broad nature of the impact to your overall claims environment. We're a little different. Cotiviti is service-based, and we use configurable rules to look for accuracy errors. And what that means is that when there's a scheduled or time-sensitive rule or code change that is published, Cotiviti implements those rules on your behalf within a monthly release process that we follow. Waiting for these same updates to come to you as a software patch for on-prem services, you may have to wait to make those available in your system for a good 6 to 8 months or more. And in addition, some code changes are even published with a retroactive effective date. A good example that everybody should be familiar with is when the diagnosis codes for COVID and procedure codes associated with the COVID vaccines were published under the emergency order in 2020. Those codes were created, and published in the summer of 2020, but then made retroactive, back to March 2020, when the pandemic had first been declared. So Cotiviti at that time was able to implement, those new codes within weeks and make them retroeffective back to March to bring plans into compliance with the use of those codes almost immediately, right? Ensuring that you're paying claims appropriately, the providers are getting paid appropriately, not slowing down the process whatsoever. So as mentioned in this slide, a good analogy to use is to compare your claims processing systems and Cotiviti as a relationship between a primary care provider, a general practitioner, as well as a specialist. It doesn't mean that your primary care provider is doing anything wrong. There are lots of things that they do well. They do the best that they can, but there are a lot of things that they don't do for you, right? And they're just not trained to do it. So you have a specialist for that. And your specialist is good at doing unique things and has specialized training to treat things that your primary care provider does not. They're both very important. They're just very different in how they approach the logic behind payment integrity editing. So how does Cotiviti act, payment integrity act as your specialist? This slide provides some high-level context as to how comprehensive Cotiviti payment policy library works with your plan. So part of our process is we carefully analyze each plan's claim data to determine what policy would be most appropriate based on your needs, recognizing every plan is unique. And even though we are in the same industry servicing similar populations of members and providers, there are unique patterns for each plan. This could be based on the quality of the claims processing platform that you're utilizing. That could be based on the provider network and specific contract requirements between providers and TPAs, and also the types of claims editing already occurring within the TPA. So our service, again, it doesn't replace, but it augments and strengthens whatever in-house payment integrity efforts you have underway. But our deep industry expertise means we can come to you with benchmarks and policy based upon plans within your regions. We can recommend best practices for payment policy that your providers already experience with a regional or national insurance plans. The library that we have, developed by Cotivity's physician-led research team, is comprehensive and covers things like global policy considerations. Think about things like NCCI to evaluation and management. It contains a full specialty policy catalog, drug and biological policies, as well as DME. So, in our opinion, for TPAs and health plans exploring payment integrity, payment accuracy, best practices, we believe that prepay intervention, will yield the best results for your plan. Now, you should have a balance of both prepay and post-pay payment integrity. You want to be able to run as much policy as you can in that post-adjudication prepay environment, right? You want to make sure the claims are correctly coded at the outset, and expedite payment, back to your providers. So providing, clear defensible sources to educate your network as to why a small percentage of claims were changed or denied, is imperative to creating a positive working relationship with your providers. Moving payment integrity to prepayment also reduces the volume of post-pay record requests or audits requested of the provider downstream. Again, this increases their satisfaction overall. Clean the claim, correct the claim up front, avoid the back end recoveries and audits. So to wrap up my section, offering a strong payment integrity plan, what can that do for you and your plan clients? It helps you meet your fiduciary responsibility to your self-funded group clients. It provides substantial medical cost savings with low administrative effort to counter healthcare inflation, right? It's a shared savings model with your payment integrity partner that helps you maintain a competitive advantage with self-insured plans who do want these services already. They're clamoring for this kind of help in their environments. And so you can improve client retention and satisfaction with both your clients and also your provider network through those clear payment integrity services. And also, most importantly, it protects the member benefit, right? It helps keep employee or member out-of-pocket costs in check. Okay, Chris, I'll turn it back over to you to talk about how to get started in this area.
Thank you, Mike. So as Mike mentioned, there's obviously a need for accurate claims payment review. Now we can talk about a few of the key factors to consider when thinking about or talking about outsourcing payment integrity to an outside vendor. First and foremost is the proven track record with prepay payment integrity, meaning, what we really mean there is the extensive experience that Mike touched on in clinical matters and policy offerings that can offer proven savings to you and your clients. Included in there is the importance of continuously updating and improving payment integrity content library to stay on top of any changes in the industry. And a managed service and a SaaS model really helps you stay on top of these changes, including any clinical support, code discussion and assessment, any maintenance. All of these things really help you stay focused on managing and servicing your clients and doing, your day-to-day day job better, right? And you may have questions about provider education and network interruption. So it's also important to consider a partner with success with your network and a name that your providers are able to trust, as well as support, provide any support on any appeals and discussion with providers where necessary. And finally, consider implementation and the experience across claims platforms. The investment that you've made with a claims platform is a huge deployment of capital, and integration and implementation ease is an extremely important factor when it comes to considering an outside vendor for these types of services. So when we talk about the factors to consider, Cotivity's been in the pre and post-pay payment integrity space for more than 20 years, including deploying across more than 80% of the Blues plans and 23 of the top 25 largest plans in the country. So odds are your provider network already knows about us, and we're already editing and auditing claims in your area today to the tune of more than $8 billion in savings annually. So success through our clinical advantage, as Mike mentioned, of the medical director-led policy libraries and editing packages that are available, unlocks savings for our clients of up to 4% on your total medical spend. So it represents a huge savings for you and your clients. And we work with each one of our clients to perform a full opportunity analysis to identify those areas of savings to help you reach your goals and service your clients better. And finally, our technology and our SaaS architecture really allows you as a TPA or administrator, again, to focus on your membership and your clients while staying on the cutting edge of clinical and coding guidelines. And it's all done through a fully managed service model with complete support, complete reporting, and ongoing maintenance where necessary. So as we wrap up here, as the self-funding market expands and employers are looking to provide improved medical coverage options for their employees, these groups are looking for ways to provide the best coverage for their members while limiting inaccurate and wasteful spending. So as groups look for self-funding options, payment integrity becomes a massive selling point to help attract and retain groups and remain competitive in this growing market. And while you're looking to unlock savings and remain competitive with your clients, the key of clinical expertise and a complete claim review across a prepayment platform allows us to meet you where you are and provide those savings. So if there's interest in saving your clients money, please reach out to us and we can set up time to walk through your specific needs and we can perform an opportunity analysis and see what we may be able to save you. So that's it for today. And we would love to do some Q&A, but first we do have a few poll questions that we're going to put up on the screen and throw out to the audience here.
Yes, we do. You are absolutely right, Chris. And I've got those up on the screen right now. So starting out, before we jump into our Q&A with our wonderful speakers and Chris and Mike, I want to thank both of you for such a great conversation and for sticking around to answer some questions from our audience. But we're starting out because we want to get to know the folks that are here in the audience so that we can tailor some of our conversation to what their needs are and where they're at. So we've got a couple of different types of organization up here, and we're wondering where you kind of see yourself in this. So no wrong answers here. Mike and Chris, are you expecting that there might be more folks kind of identifying with one group or another?
Yeah, I would say, I expect there to be a high representation from the TPA and administrative services side of the house here. There's so much activity in this space in general that there's interest from multiple different groups, including brokers, including the self-funded group itself. So I do expect to see some folks from all different areas, but I would say that the highest will probably be from the TPA or ASO side of the house.
Okay. All right. Well, should we see if you're right? We're going to check it out. All right. Ready, folks? Here you are. So, yep, bang on. We're seeing the vast majority of people in the TPA, ASO, MSO, and then closely followed by health insurance plans. So this is kind of in line with who you'd expect to be interested in this conversation.
Definitely, yeah, definitely, and it's good representation across some of the different folks that may have interest in payment integrity, and really shows how important payment integrity can be.
That's a really good point. Yeah, lots of different interest groups here. Well, we've got one more question for the audience here. And this one I'm really curious about. What do you see as the biggest challenge to cost containment strategy in your organization? So what is really the biggest problem in your organization? Now, this one, guys, I'm really curious. Do you think from what you've seen in the conversation that you're having, is there one that's jumping out at you as the number one pain point? Chris or Mike, any? Sorry,
I would
go
say
ahead.
this is Mike. I would say particularly with smaller plans and HSAs, and even larger plans have the same problem with, ongoing regulatory support and change, right? The policies are changing all the time and it's hard for people to keep track and keep up with them. And I would say too, it's the communication with those changing policies and changes in claim rejections or denials and communicating that back to their provider system, the provider network, so they have a clear understanding of what is going on as claims are evaluated and responses are provided back.
Well, I'm really curious to see where this one falls and what has been sort of a major pain point for folks in the audience today. So I'm going to head over to our results. Let's see what you all said. Last second chance to click if you haven't already clicked on the poll. All right, so that's a really even split. What does that tell you guys? Are we facing all these problems simultaneously, or they're all pretty common?
Yeah, I'm surprised at the even split. Usually it's heavily weighted one way or the other. I think like I think during the presentation we mentioned how even though we're all in the same industry, providing same types of services, every plan's a little unique, right? Some are
Mm,
on aging platforms, maybe providers, their own offices and how they're submitting claims could be aged as well. So that clean claim coding, uh, and the IT support, could lag in those areas. And as mentioned, how do you communicate to your providers, right? Is it a phone call? Are you letting your provider, phone in for explanation? Do you provide an electronic format or a digital format that they can self-serve and look at their claims and look at the reasons why a claim was changed or denied to then change their patterns of behavior in the future? Um, yeah, again, every plan's a little different, so I think that's why we see the spread.
yeah, and
Yeah,
that's a. Oh, sorry. Go ahead, Chris.
yeah, no, I was just going to say, I think the even split there really shows the breadth of concerns that the industry does have around, these types of problems, right? So we may have IT folks on the line that have one set of issues, and we may have, clinical folks who have a completely different set of issues, right?
Mm.
This is a fairly niche market in general, but there are still, a wide array of issues that can come up and kind of cause problems for different areas of different organizations, as Mike said.
Well, I think you're really hitting on it, and that's interesting that even within a niche market, you can have a wide breadth of experience. And I think to both of your points, that is really important to any industry right now. But being able to sort of meet the organizational needs where they're at, and what is specific to their setup and their organization. So it's really interesting to see that there are so many different problems coming in, and then luckily we've got some solutions that you guys have given us a lot of ways that we can address some of these problems, which I think is going to transition us into some questions from the audience, because I want to start getting into what we're hearing from the folks here with us today. Mike, Chris, you guys ready? Can I put you in the hot seat? Can we get into some Q&A?
Yeah, absolutely. Sounds good.
All right, Chris, I'm going to start out with you on this one. So we have a member of the audience saying we have a team that does some payment accuracy reviews on high dollar claims and eligibility reviews today. Can you talk about how you operate with our team that is currently performing these reviews? So how would you fit into that existing case, Chris?
Yeah, it's a really good question, and thanks for bringing this up. We see most payers and TPAs and administrators, that have some level of reviews being done internally today. It may be a high dollar review. Mike talked a little bit about it during the presentation as well, but, say things over $50,000 or $75,000 in paid amount, for example. Our clients also may have a full team doing, eligibility reviews or niche fraud, waste, and abuse reviews that are, very specifically tailored to individual providers, for example. So there are a number of different setups that we see in the space, and we actually suggest multiple layers of review to make sure our clients are capturing the most, savings they can and paying claims as accurately as possible. So we want to fit into our client's ecosystem when it comes to multiple vendors and multiple people in the space doing these types of reviews. So we're flexible when it comes to setups in terms of past positions and other vendors doing other reviews as well. So I'll pause there. Mike, was there anything that you'd like to add in terms of what you've seen in the industry?
No, you're right. Yeah, I think flexibility is key. I mean, there are a lot of different vendors working with plans to do different things, such as prior auth, or pricing, in terms of the claims adjudication function. We've typically come in as a comprehensive, filter on rules. So we're not meant to replace, personnel you may have in-house doing payment integrity activities with your plans. It's simply meant to augment and expand, the scope of review of what they're doing.
Mm,
So oftentimes, the placement of our service, the intervention point, is key, to really fit into the operational rhythm of how a TPA will process claims in-house. and how different teams may service claims either internally or if they outsource it to a vendor such as Cotiviti.
Yeah, lots of emphasis on flexibility and scalability. I appreciate that. I'm going to actually, Mike, I think I'll keep the mic. Mike, I'm going to keep the mic with you because I have a question that I'd like to send your way. I love when people ask questions getting into sort of key uniques. I think that's a really important thing, especially because folks are often, doing research and kind of weighing out different vendors and different decisions that might work for them. So we have a question coming in about your content library and wondering if you could explain a little bit how your content library is different from other editors in the space. Mike, can you give us a little clarity there?
Yeah, sure. I think I'd frame it as our content library. I argue is the most comprehensive collection of payment integrity policies in the industry, and I feel like they're the most accurate. That is something that our clients really value us for, is the accuracy of payment policy, making sure it is applied correctly, correctly coding claims moving through systems. We have a wide range of policy that applies an overview and editing to professional, outpatient, inpatient claims, drug and biologicals, etc. All that policy is reference sourced, that supplies the backing to our policy, and it's all clinically reviewed by our medical director-led team, and then rigorously tested as well. So I think again, it's not a piece of software that we're deploying out to plans to go manage on their own. It's a managed service, and I think what sets us apart is we're a good partner with our team, and even though our library is so vast, it's our teams help clients make informed decisions about policy that is appropriate for their plan. So for a plan, for instance, that has limited payment integrity policy in place, it might be a mistake to turn on, let's say, all of it at once, right? That'd be pretty shocking to the provider system. So there's often like a gradual ramp of policy that's logical and orderly for plans to follow. So I think, what differentiates us is, it's not a generic software packaging that you're purchasing. It's not something you need to technically source or enable within your own systems. It's as a managed service. We're automating the policy for you. We're testing it. We're helping you decide what fits into your packages. And then for those things that are not automated, we have the with our coding validation product, claims that are flagged, claims a little bit more complex. We have teams of nurses and code experts that review and provide kind of a human review to those claims and the contextual background of a member to make sure that the edit applied is appropriate. So it's comprehensive, good partner, vast library of claims, but it's only the policies that are appropriate for your plan, not just a generic set.
It's a very good key unique. Before I move on to the next question, Chris, sorry, did you have anything you wanted to add?
No, I think Mike covered that perfectly. It really is the breadth and depth of reviews that sets us apart, and that's something that all administrators or health plans should be looking for when they're considering a partner to do these reviews on their behalf, because it is it's their membership and it's their dollars, so it's an important factor to consider.
This is interesting, and we did just get a question in while we're kind of talking about differentiators and uniques. A question from the audience: how is this different from what PBMs do?
Yeah, I'll take that. When we're working with health plans, I mean, there's typically three types of claim systems that we're interfacing with. One is a medical claim system. A second is a pharmacy benefit manager. A third will be dental claim systems as well. So when we're talking about payment integrity, it's you want to look at the comprehensive or the contextual processing of a member. So when I think the question, how is this different than a PBM? Well, I think either a PBM or a medical claim system, they do a good job with accepting claims, doing clean claim coding within their services for administrative tasks, applying prior authorization rates, applying pricing. And so the claims that Cotiviti receives, let's call it 95% of those claims are fine, right? They're normal. We make no change whatsoever. But 3 to 5%, will have an issue. And so what Cotiviti does for the medical claim system is looking at, again, comprehensive rules that a plan may not have in place. It's looking for claims holistically. It's not simply by dollar amount or by provider type. It's looking at claims across the whole spectrum. And from a PBM perspective, we also do reference PBM claims as part of that medical contextual history. So I think the answer is, claim systems, do a pretty good job, in this area, but providing a good payment integrity vendor on top of that to kind of provide checks and balances is what's, is really where the value comes from with the payment integrity systems.
Perfect. We are getting very close to the end of time. I'm going to try to sneak in one last question before we start to wrap things up here. Question, and I think, Mike, I'm going to send this to you again as well. So one issue that we see with claims review is the difficulty with provider relations and giving information when they call. Yeah, I think a lot of people can relate to that. Mike, how do you handle provider relations?
Sure. Yeah. We mentioned this in the slide deck a little bit. Put yourself in the shoes of a provider. When new payment integrity rules are rolling out, right? You would want to be informed and have some communication. We find that keeping providers informed through a provider portal and up to date with major payment policies that they may be putting in place is a best practice. And that's essential to kind of keeping up a good productive relationship between a plan in your provider network. Cotiviti, we approach this by empowering the health plans that work with their providers, right? The health plan owns that relationship with providers, but we offer services as part of our packaging that both plan administrative staff can access to look at script and rationale to field calls that are made by providers that have questions about claims that have been edited, whether it's a change or denial. And there's also a web service that health plans can tag onto their provider portal to provide provider self-service. They could log in themselves any time of the day and find out why a claim was paid a certain way. So again, the tool that we provide provides really clear claim detail about what was submitted. It provides the rule and the edit that was invoked. It provides in plain terms the script and the rationale as to why that edit took place. And then it references the reference source that rule came from, so that provider can learn and then change behavior, change habits moving forward.
Well, I wish that we could take a little more time with the audience because there's a lot of questions that we haven't gotten to. What I want to assure everyone in the audience, though, right now is that if you have a question that you've asked that we have not gotten to, you are going to get an answer back. So we are going to make sure that Cotiviti gets all of your questions and you will hear back from them. So if you have a last burning question that's digging away in your brain, make sure you get it in right now. And if you asked a question that we didn't get into with Chris and Mike, you will get an answer back. So stay tuned for that. But I want to give the folks in the audience a way that they can learn a little bit more right away. Now, one option, we've got a QR code up on the screen. It's also linked in your handouts tab. Mike, this is a white paper that you wrote.
Yes. It's just a white paper explaining, TPAs and kind of different strategies that plans can take when they're integrating payment integrity vendors, into their system. I hope people find it informative, but it should supplement the presentation that Chris and I just gave pretty well.
Well, I think that's awesome. And anything more we can learn from you, Mike, is great. Chris and Mike, before I let you both go, I'd love to ask you for kind of a final wrap-up thought. And I'm thinking if there's either something that you would like everyone in the audience to sort of be walking away knowing from your presentation, or something that you'd like to see them take action on. And maybe, Mike, you can kick us off, and Chris, you can take us on home. Mike, you're welcome to say, read your article. That's a fair answer.
No, nobody wants that. But I think... No, I think plans, they should take from here, for people that have joined us, comprehensive payment integrity services is very common, within large national plans and Blue Cross Blue Shield plans. It is lesser known and invoked within, the self-insurance and TPA market. So having plans leave here and then conduct an assessment of what kind of payment integrity measures they have in place and what kind of value they're providing is important. And if they feel that they could be deficient in that area, then to reach out to us to help them conduct an evaluation to see where gaps could be filled and expertise could be brought, to augment whatever else they're doing in-house today.
I love that. Great final thought. Chris, do you have you're our grand finale, Chris. Do you have a final thought or an action step you'd like to see the audience take?
No, I think Mike hit on it perfectly. I just want to thank everyone for their time today. We had a great time presenting this. And if there are any questions, after this call, after this presentation wraps up, feel free to reach out to myself or Mike directly. We'd be happy to schedule some time and walk through some of the options that we have in terms of payment accuracy and payment integrity reviews. And again, we'd love to hear from you if you have additional questions, and we'll be sure to get answers to the questions in the chat, and make sure everyone has everything answered, and we're ready to go.
Oh, that's awesome. Chris, Mike, thank you both so much for being here with us today. I've had so much fun chatting with you guys.
All right, thank you.